It's like throbby and achy, and sometimes it's stabby.
14-year-old Hannah Miller is describing the mysterious pain on her side that's plagued her for more than a year.
We've been through tests after tests. We've done lab work repeatedly. We've done ultrasounds, CAT scans, x-rays.
But no one could figure out what was causing her pain. When she finally visited the complex pain medicine clinic at Children's National Medical Center, doctors diagnosed Hannah as having chronic pain and suggested an unusual course of treatment.
Go ahead and put your other hand on top.
The treatment didn't involve drugs, just smelling scented oils, Reiki, and Tibetan singing bowls.
It was better than any medication I could have given her at that time.
Dr. Sarah Elizabeth Rebstock is the clinic's medical director. She says alternative medicine is becoming mainstream as more and more studies back up their use. And while they don't always know exactly why these treatments work, Dr. Rebstock says they seem to help kids relax, and that can spark healing.
So if they think that this is part of play and relaxation and they're having things that are pleasant for them, they're also going to feel like they can get better.
So we just have to figure out which works for which patient.
Registered nurse Marion McEvely is the hospital's expert on these techniques. She's the one doctors call on when they've run out of treatment options. Her regimen includes aromatherapy, which is having young patients smell different oils depending on their problems. Also, Tibetan singing bowls, an ancient instrument that is supposed to shift energy, and this.
I have good nurses. They're great. They won't hurt me.
The emotional freedom technique, or EFT, is when patients tap their fingers on acupressure points around their body while talking out loud about whatever is bothering them.
I get lots of times where people think I'm crazy. So. Especially the doctors, they go, oh, you're doing that tappy thing. So, but when they see it work, then they're the first ones to call me to ask me to do some tappy thing with some kid.
McEvely says she's not sure how it helps, but it does. Hannah Miller says her pain is now diminished.
It just makes me like calm down.
Hannah says the pain is still there, but now it's tolerable. Both she and her mother believe she's finally on the right path toward healing.
I hope it all goes away, and I hope she lives a normal life.